Everyone, so it's Q&A Friday. We have some great questions, so I'll just get right to it. So the first question comes from Andrea, and she asks, I've read about borage oil. I'm just wondering if it would be good for us who have lupus. So borage oil is an anti-inflammatory fatty acid called alpha or gamma linoleic acid, GLA. While it's a good thing to add to your regimen, I would also add the omega-3 fatty acids to have a good balance. I would also consider CBD hemp oil for more of a potent anti-inflammatory effect as well. Okay, so second question comes from Lauren, and she asks, has anyone opted not to take pharmaceutical drugs and go natural route with diet change and vitamin supplements? So Lauren, I've done this, but would highly recommend that you keep your rheumatologist in the loop. I never really necessarily told her everything and that's why I call myself the rebel. But you have to understand that lupus is a potentially dangerous disease, so it's wise to be monitored. My experience was overall positive, but you may need to make sure you follow the right diet and supplements specifically tailored for you, as what works for you may not hold true for someone else. We're all genetically, environmentally, and demographically different in different life stages and have different stressors. So you want to make sure whatever you do, you're trying to go rogue, you want to make sure you're doing the right things. And so I would highly recommend you continue to go to the rheumatologist and make sure you monitor your progress by checking your labs on a regular basis. So being sensible is key. Lauren asks the same question. Has anyone had success with Protandim? Well, I'm afraid I really don't know too much about this other than the fact that it has been pulled by the FDA for false claims. So that doesn't mean much for me because a lot of the holistic treatments, FDA doesn't like claims being said. But I would have to do a little bit more research to give you a better answer. So let me sum it up and let me look at some research. I've read a little bit about it, not enough to give you an honest opinion on exactly what that does for you. Lauren asks, success after fixing leaky gut. Well, I've been healing my gut since 8 years ago, and it's made a world of difference. My hair, my nails, and energy levels have never been better. I do have issues from time to time as I have very sensitive gut flora and frequently get digestive upset. But gluten-free, low-carb, intermittent fasting is key to my health today, along with a good quality probiotics. So I hope that helps. So I just want to make sure my questions are good here. Next question is asked by Kimberly Logan. She asks, hi, I have many autoimmune issues and systemic lupus. I'm currently battling joint issues and have fractured a bone in my foot and tears in my Achilles tendon. The orthopedic surgeon has informed me that I need surgery, a triple arthrodesis of the foot to allow fusion of the bones, and he said that he treats a lot of lupus patients for foot joints and bone issues. Has anyone ever had the surgery, and what was the aftermath? Thank you. Well, Kimberly, sounds like an extensive surgery. I'm so sorry you're going through that. As a clinician, as a physical therapist, I've treated a number of patients with that kind of a surgery. They did have certain kinds of autoimmune conditions, some not so much. It was a simple accident that they had. But for you, I'm curious to know if you have Ehlers-Danlos syndrome, as it sounds like extensive connective tissues are involved. Just a thought I would check. And other than that, the recovery should be very, very extensive. So you need to find a very good physical therapist in your area to ensure a safe recovery. And I wish you best of luck. And if you have any questions about your recovery, feel free to ask me. Last question is asked by Rosalind. She asks, Dr. Connie, would taking 1,500 milligrams of curcumin daily enough to lower the SED rate? Also making dietary changes too. So SED rate is a biomarker for inflammation. So yeah, I would take a little bit higher dose to have an impact on that SED rate. I would take about 2 grams of good quality curcumin, add a good quality fish oil, and follow an elimination diet is what I would recommend. And even to go further, if you really wanted to make an impact, I would also advise you to consider healing your leaky gut. And that takes a very methodical approach of eliminating certain foods. So I promote the elimination diet a lot for that reason, to allow your body to sort of decrease inflammation while healing the gut, as well as incorporating some intermittent fasting, meaning try to give your body a long hour in your given 24 hours, at least 15 hours of fasting, which means, let's say you have dinner at 6 p.m. at night, don't eat breakfast until maybe, so that's 6, maybe 12 o'clock the next day. And then you can sort of, incorporate that into your regimen. That'll help you to have anti-inflammatory effect as well, along with all the other things that I mentioned. So there's so much you guys can do. So these are all great questions that you're asking in this group, and that's what this is all about. So I hope all of you guys have a great weekend, and I will see you guys next week.